Quality Watch is an educational production of IPRO. Opinions expressed reflect the views of the speakers only and not those of any company or agency. This podcast is intended for private, non-commercial use only. Please visit ipro.org to read our full disclaimer and terms and conditions.
Welcome to Quality Watch, the podcast focused on healthcare quality improvement. Quality Watch is a production of IPRO, a trusted partner of federal and state agencies working to measure and improve the quality of healthcare for all. I'm your host, Dr. Edison Machado, Senior Vice President of Strategy Solutions here at IPRO. In today's episode, we'll cover CMS's final rule changes to Medicaid managed care, national recognition for IPRO's Kidney Transplant Compare app, and much more. But first, a few quick headlines and updates from around the nation and here at IPRO. As flu season arrives, providers around the country are gearing up for the winter ahead. According to the CDC's weekly influenza surveillance report, FluView, influenza strain H1N1 and H3N2 are currently co-circulating. This matches well with the trivalent vaccine being offered this year. Looking ahead, the FDA recently approved FluMist, a self-administered nasal spray flu vaccine for the 2025-2026 season. This new vaccine form provides greater accessibility, ease of use, and flexibility for individuals and families, allowing both healthcare providers and caregivers the ability to administer the vaccine. We are currently in the Medicare open enrollment period, which ends on December 7th. Among the changes announced for 2025 are a $2,000 Part D prescription drug spending cap, elimination of the coverage gap, otherwise known as the donut hole, and telehealth coverage. For those interested in learning more, please visit medicare.gov. And here at IPRO, Rob Aceta, a senior pharmacist, has been asked to serve on the Partnership for Quality Measurement Pre-Rulemaking Measure Review Committee. He will participate in the committee's post-acute care and long-term care advisory group. He joins IPRO's Director of Medication Safety, Teresa Lebowski, who serves on the Clinician Advisory Group, and IPRO's Assistant Vice President of Data and Analytics, Nicholas Matisse, who serves on the Hospital Advisory Group, giving IPRO representation on all three PR/MR advisory groups. As an external quality review organization, or EQRO, IPRO works with states to evaluate the care Medicaid managed care organizations provide to Medicaid beneficiaries. As many of our listeners know, Medicaid is the safety net program that provides healthcare coverage to low-income and medically needy individuals. It is funded jointly by the federal and state governments and operated by states working within federal regulations. States seek to provide access to high-quality care for Medicaid managed care members through a variety of means. One of the levers that states use to improve quality is called state-directed payments. Here to explain more about this approach is our guest today, Jennifer Edwards, IPRO's Associate Vice President in our Medicaid Managed Care Department. Welcome, Jennifer.
Thank you, Eddie.
Well, Jennifer, let's get started. Can you start by explaining briefly what state-directed payments are in the context of the Medicaid programs?
Sure, I'd be glad to. So state-directed payments in Medicaid are mechanisms through which state Medicaid agencies direct managed care organizations to make specific payments to providers. These payments are designed to support state policy goals, such as improving quality of care, improving access to health services, or addressing specific healthcare needs. State-directed payments give states another tool in their toolbox for improving healthcare. Payments can also help to stabilize finances of essential healthcare providers, ensuring that they continue to make care available to vulnerable populations.
Thanks, Jennifer. For those who are not familiar with state-directed payments yet, how long have they been around?
Yeah, so state-directed payments are not as new as you might think. They were actually introduced into regulation in 2017, And CMS approved the first state-directed payment applications in 2018. And since then, they've just really taken off. As of last year, CMS had approved nearly 1,000 state-directed payment initiatives across various states. And then just to show the sheer breadth of how many states are involved, in the past two years alone, 39 states have implemented state-directed payments.
Well, that's interesting. I had no idea there were that many states who had implemented state-directed payments. Jennifer, would you mind going in to detail a little bit more of how these SDP programs work?
Sure. So the way that they start is usually with the providers or sometimes the managed care organizations approaching state Medicaid agencies about work that they would like to do to help accomplish healthcare goals for the Medicaid population. They will have designed an intervention that helps accomplish a goal. So, for example, one of the state-directed payment programs we've seen helps to improve access to mental health and substance use disorder treatment. And then the MCOs or the hospitals also design a payment model that rewards accomplishment of the goals. Then what happens is that the states can work with the plans and the providers to tweak these, but then the state has to be the one to submit the proposal to CMS. And what we've been reading recently is due to the fact that there's a new regulation out that provides more insights as to what CMS is intending to have happen going forward, starting in 2027. There will be some changes to the program that we can talk about.
Jennifer, how can IPRO work with states on these valuable programs?
IPRO can play a vital role in helping states with their state-directed payments by providing analysis and recommendations to ensure that these payment programs are effective and achieve their goals. This year, CMS expanded requirements for states related to oversight and evaluation. And now, any SDP that's worth over 1.5% of states' capitation rates will require that an evaluation be done every 3 years, starting in 2027. This can be especially burdensome on states and MCOs. So CMS provided guidance to states suggesting that they use their EQRO to do the evaluation.
Thanks, Jennifer. That was really helpful information. Can you go a little further and give some examples of how IPRO has worked with states on their state-directed payment programs?
Yes, I can. So with regard to state-directed payments, IPRO has already helped states in several ways. We have helped by measuring the baseline performance of the providers who are engaged in the state-directed payment program. We've also helped by remeasuring periodically, quarterly or annually to determine progress and analyzing the data by comparing data in the program to a comparison group. And then we help with the reports to CMS. And we've been doing this through both quantitative and qualitative research methods. We can also help states to set performance standards based on their historic rates or external benchmarks, and then help align care delivery improvements with the state's goals. So with our expertise in measurement, reporting, and quality improvement, we can help in a lot of ways.
It sounds like there's quite a bit of data collection and analysis underlying the examples you just walked us through there, Jennifer. Can you expand a little bit on that?
Yes, so the data that is important to use for state-directed payment programs can come from various sources. So we can use claims data, which, in a lot of cases, if IPRO has an existing relationship with the state, we have access to the claims data. But we can also design data collection tools for use with specific providers. And we can do that through streamlined data reporting methods. We also do a good amount of interviewing where we go on site with the hospitals and we ask them about their work so that we can understand really the operationalization of these programs, not just the metrics that are reported to us. We also look at provider performance and patient care by different subgroups, and that's often helpful to states in thinking about how to tweak their programs and make them more targeted, more effective. And then lastly, we look at the relationship between payment models and healthcare outcomes. And this is really where we're getting into more rigorous research methods with the comparison groups, like I mentioned before.
Jennifer, thank you for that additional information. So, the goal of state directed payment programs is obviously to improve the quality of care that Medicaid beneficiaries are receiving. Can you elaborate a little bit on how EQRO specifically can help ensure that STPs achieve that goal and that improvement is tied to quality measurement?
Yes. So there are a few ways that EQROs can help. One of the ways that we would start working with the state would be to look at gaps in care or areas where there's underperformance relative to priorities that the state has set, maybe through its quality strategy. So if states are finding that a certain subpopulation, a certain geographic area, or maybe all members are not getting access to the kind of quality health care that they deserve, then IPRO can help by looking at states' data and identifying those opportunities for improvement. And we can also do a literature review and find out more about what some of the opportunities are, best practices from other states or from the federal level, and try to bring new ideas to the state for interventions. We provide also recommendations for refining payment structures or adjusting performance metrics or targeting some of those high need areas where really very little study has been done so far. And then finally, we can assist states in redesigning their state directed payments to be more effective and responsive to healthcare needs, particularly in how they use quality improvement methodology to make transformations.
Appreciate that, Jennifer. It sounds like the SDP programs can really be a valuable tool to move the dial on quality improvement. Um, what are the challenges you're seeing states and MCOs, though, encounter as a product of this program?
Yeah, like with any program where there's no valuation tied to payment, there is room for disagreement about the data, which members are counted and which are not, whether to include people, for example, who switched providers in a year. How do you attribute them to one provider or another? Or if they switch plans, how are you attributing them to one plan or another? And then through the last year, we've seen a lot of turnover in Medicaid coverage, and fewer people are getting Medicaid now. So are those folks in or not in the denominators, and so on? So the best way to count it can be sometimes controversial. It's best if states can work through these issues before submitting a proposal to CMS, and that's one of the ways that IPRO can help.
Understood. So I know you mentioned at the very top that EQROs as a whole are positioned to help Medicaid agencies with this work, but there's a few of them. So what sets IPRO apart? And in particular, what support can IPRO provide that states Medicaid agencies should be aware of?
IPRO is an expert in identifying relevant and feasible measures and defining measure specifications. We have a team of health services researchers, including people with expertise in biostatistics, epidemiology, and mixed methods research, who can design and carry out a study to suit the program. For example, we can help define measures, identify data sources, collect and analyze data, and report results compared to benchmarks. And then, as I mentioned earlier, we also collect qualitative information through interviews and observations to understand the context in which SDP initiatives function. This rounds out an understanding of what works and what doesn't and why. In one state, these process evaluations have led to annual feedback to the providers, which has contributed to them improving the program each year.
Well, thank you, Jennifer, for that comprehensive overview of state directed payment programs. You know, it's interesting when you unpack some of the ways in which payments are tied to quality improvement across the healthcare landscape. And before we finish up, just want to give you an opportunity to pass along any parting words for our listeners, Jennifer.
I guess the last thing I would add is that CMS is giving states feedback that they should be linking state-directed payments to their quality strategy. So if a state isn't already aware of that as being a recommendation, they might take that point away.
Yeah, thank you, Jennifer, again for spending some time with us going over this interesting topic.
Nice talking with you.
For more information, please feel free to visit the IPRO website at www.ipro.org. It's now time for us to crunch some numbers in our Data Watch portion of the program. November is Diabetes Awareness Month. The CDC estimates that 29.7 million people, or nearly 9% of the U.S. population, have diagnosed diabetes, which includes 352,000 Americans under the age of 20. And there's an additional 8.7 million people who are believed to have undiagnosed diabetes. And new data from the CDC shows that Alzheimer's disease is the seventh leading cause of death in the U.S., affecting 6.5 million adults over the age of 65. Many of them rely on emergency departments for their care, with 36.1 emergency visits per 1,000 adults with Alzheimer's from 2020 to 2022. 37.2% of those visits resulted in admissions, compared to 28.6% for adults without an Alzheimer's diagnosis. ED visit rates for this population are higher for women versus men and highest among African American adults. And there's some good news for end-stage renal disease patients. Since it launched in August 2023, the IPRO End-Stage Renal Disease, or ESRD, Kidney Transplant Compare app has been used on more than 2,000 computers, more than 16,000 times, and downloaded on over 654 mobile devices. IPRO's ESRD network of the Ohio River Valley, which developed the app, was recently awarded the American Association of Kidney Patients 2024 Dominic Gentile MD Memorial Award, which recognizes programs that significantly benefit kidney patients. The app allows patients to do a side-by-side comparison of multiple kidney transplant centers to find the one that best meets their needs. That's it for this episode of Quality Watch. I'm Dr. Edison Machado, and on behalf of IPRO, thank you for listening. To learn more, visit our website at ipro.org. That's IPRO.org. And if you enjoyed this podcast, please leave us a comment and subscribe wherever you listen to podcasts. We will be back next month with more. And until then, we'll be working on better healthcare realized.